so every shift we have to clean the trach. So when we clean the trach, we take everything off, we put a new collar on, we clean around the trach, and we change the inner cannula, or clean the inner cannula if it's not disposable. So first, it comes with, it's one of these little, like, drainage, you know, it's just a prep, so I usually put it over his chest. So I put that on his chest, and you'll see it comes with gloves. So normally you're going to be wearing gloves, but it also comes with gloves. It comes with pipe cleaners. Like if you were going to clean an inner cannula, you could use the pipe cleaners. Usually you don't need them. It has cotton tip swabs, so you can clean behind the trach. It has a bottle brush to clean inside the inner cannula. It works good on your ears. And then it has little gauze sponges. So you can use one of the little, I usually use one of the little containers. I either put, depending on where you work, if some hospitals use only normal saline, some use half hydrogen peroxide, half normal saline, so it depends on where you work. So I'll fill this up with fluid. I'll put my gloves on. And then also it has, if you had to remove the sutures, it has these to remove the sutures. Okay, so the first thing I'm going to do is I'm going to take off my trach tie.
Now, is this whole thing sterile?
No.
No.
Only when you're going to change the inner cannula.
Okay.
So anything that's going to go inside the patient, then that has to be sterile.
Okay.
So I'm going to take off this, and I usually, this, like I said, you can put all your stuff on. Then, taking my collar off, and then I'm going to use the gauze, dip it in the solution. I'm going to start cleaning around his neck, all around his neck, and then I'll even use the Q-tips to clean behind his trach. Okay, so once that's clean, I'm going to place a new drainage sponge underneath the patient, even though this is the old drainage sponge, but I'll place a new drainage sponge, a new collar on my patient. And then the last thing that you'll do
We do this every 24 hours?
Every 12. So every shift we'll be doing it, so every 12 hours. And then I put my collar on, and then the last thing I do is I change my inner cannula. So I throw this one out, and then I'd have a new one that I would insert. So, and this would come in a package, and I would open it, and I could only touch this part of it. I can't touch this part. And when you put it in, you're going to just put it in like a hook. So once I get to this point, I'll hold the trach and just clip it on. So that's cleaning the trach. If you had to clean the inner cannula, you just want to, when you take it out, you just rinse this with sterile water. Don't touch this. Keep it as sterile as possible, and then put it right back in the patient. Number 6, what would you do if your patient popped out his trach? So here's your patient. You're like, "Hi, Mr. Jones, how you doing?"
Oh. Does that really happen?
I came in the room and it's on the floor. So then what do? So his trach's on the floor.
You need a completely new trach.
Yeah. So now that it's hit the floor, you're going to have to use another trach. So that's why you always want to have a spare trach at the bedside. So anytime you have a trach patient, make sure you have a spare trach and that the actual trach is the correct size. Because you don't want to try to get an 8 trach in a size 6 hole or something like that. So you would need to get a new trach, because you can't just take that trach out and put it in the patient. And then the other, number 8, does the cuff stay inflated on someone who's not on the ventilator? So if the patient is not on the ventilator, the cuff does not have to stay inflated. So the answer to that question is no. It does not have to. If they're on a ventilator, yes, it does. On a ventilator, yes, but off, no.
Worst case scenario, you come into the room, the trach is on the floor, and you need to go to storage to get another trach because there's none in the room. In the meanwhile, is this guy going to be able to breathe?
Well, that's what you're going to be assessing. Okay, so if you come in and he's having difficulty breathing, the other thing that a trach patient always has, they should always have an ambu and a mask at the bedside. Worst case scenario, you cover the trach with your hand and you can ambu the patient through their face, you know, with a face mask like normal.
And tell someone else to get
Yeah,
it.
that's the worst case scenario. If he looks okay, you might be able, or you may be able to call somebody and say, hey, go get me a trach. You know, and you probably want to, you know, make sure you're giving him oxygen until you can get that trach back in. Okay, so that's what you're going to do with your trach tubes today.
It's full of grease?
Yeah.